The Center for the Improvement of Human Functioning International presents this luncheon lecture. Today's topic, Fending Off Colds the Natural Way. Your presenter, Chad Krier, MD, DC.
Well, we're going to look at some different therapies that you can use to try to fend off the common cold. And when we're looking at these therapies today, this is not by any means all-inclusive. It's just some of those that are kind of oddballs that a lot of people haven't heard about. Some of them are the more common ones. But I want to get into some different botanicals that probably aren't as familiar to a lot of people, and these botanicals can be very helpful, so we want to kind of explore some new territory a little bit today. Well, what is the common cold? It's just basically a virus. So it's a viral infectious disease, usually of the upper respiratory system. It can be caused by a number of different viruses, and that's the problem, is that there's 100 different types of these viruses that can actually cause the common cold. So it becomes very tricky for our immune system to have any kind of accurate way to attack the common cold. So that's why we're all afflicted, we can become afflicted with that pretty easily. So, and those are just different names of all the viruses, but just so you know, the common cold, it's not bacterial, it tends to be viral. There's tons of different viruses out there. It's tricky for our immune system to try to attack those things. So we really can't build up an immunity to the common cold. Well, how do we get the common cold? Aerosol form, so what's traveling through the air, people beside you coughing or sneezing, and you breathe in that air, that's a good way to get the common cold. Sneezing on your hands and then reinfecting yourself over and over. So it's probably the best idea is always to sneeze into your elbow if you can. Contact with saliva or nasal secretions, so drinking after somebody who has a cold, they can leave their saliva on the cup, and so you can catch a cold from drinking after someone. Again, the virus, a lot of the times it has different entryways. Any opening in our body can be an entryway for a virus, so our eyes tends to come in this part of our eyes and go through the nasolacrimal duct. It can go through our nose, go through our mouth, so there's lots of different ways. So if you're around somebody who has a cold, it's always a good idea to maybe keep throat gargles on hand or just gargle with salt water, something along those lines. Again, eye rinse. You can get those gentle eye soaps or gentle eye rinses. You can just dip a Q-tip in water and scrub the inner lining of your eyelids. That can be a great way to prevent the viral entry. So, again, this just kind of shows you, a lot of people know, you can get the cold coming through your mouth or through the nose, but we forget about the eyes. And so, again, all those little viruses can set there on the eye and then eventually drain down into this duct and then find their way to the back of our throat, get into our lungs that way. So, one of the hygienists, which was a group of medical practitioners who talked about just hygiene, clean air, clean water, taking care of yourself naturally, they would advocate that people would take Q-tips and gently wipe their eyelids every morning and every night as a way to help their immune system. Well, replication, so once you get the virus inside of you, how long does it take before that little virus starts to multiply? Well, it can start within 8 to 12 hours. And then symptoms, once that virus gets in there, half a day or so later, it really starts to multiply. It may be 2 to 5 days after you've come in contact with the virus before the symptoms start to show up. Although sometimes they, if it's a pretty virulent little critter, then you can start to have symptoms quickly. So you may think you came out okay because you didn't find that you had a cold after you were sitting beside somebody who sneezed the whole time, and you didn't have a cold within a day. Well, 2 days later, guess what? May come on. The symptoms may come on. So just again, I think everybody knows, common symptoms: sore throat, runny nose, nasal congestion, sneezing, cough. Other symptoms that can be associated with these viruses: pink eye, the muscle aches, fatigue, headaches, all those good things. Well, again, if our immune system is able to go into battle and do things like it should, then the symptoms of the cold, they may come on 2 days after we're infected, but they should go away about a week to 2 weeks after the onset. If they're not going away, then you may have more severe problems. Maybe it turned into a bacterial infection. Maybe you have a fungal infection. Maybe your immune system is suppressed to the point where you can't handle these virus infections. Or maybe it's not the common cold and it's one of these more advanced viruses. Now, children, it is okay for them. Their immune system is in training as they grow up. So the little kids, the pediatrics, all up into junior high, their immune system is in training, so it is okay for them to have colds, and so they may have 6 to 10 colds per year. Now, we don't really want them to have that many, and hopefully they're not out of control, but they can have little sneezes and sniffles, and that's just part of their immune system training. Now, when colds tend to be more common right about now. Why is that? The cold weather is drying to our mucous membranes. As our mucous membranes dry out, the more dry they are, the more irritated they can become. The more irritated they become, the easier it is for viruses, bacteria, things of that sort to gain an entry into our system. So with all the heaters that'll be clicking on, things will start to dry out. Also, cold weather, we're not outside as much. We're not spread out. We tend to be indoors in close proximity to other people. So the rate of spread is easier during this time of year. Well, some of the problems that we worry about if you get the common cold and you already have some other chronic conditions like chronic obstructive pulmonary disease, maybe you have asthma, bronchitis, or emphysema, and you already have poor lung health, poor sinus health, poor upper respiratory health, when you get the common cold, it can be more nasty for you than for the general population. So we really want to make sure that if you have any immune deficiency, anything that's affecting your lungs or your sinuses, that you take care of yourself in the fall and winter, trying to boost your immune system so that you don't become susceptible to these common illnesses. Well, and another reason, the cost. The cost is pretty staggering if you figure out what people are spending just on the common cold. It's 75 to 100 million physician visits annually. That's about $8 billion a year for those visits just for the common cold. $3 billion spent on over-the-counter drugs. $400 million or half a billion almost on prescription medicines just for symptom relief. Not that they're going to cure your cold, but they may help with the symptoms. The biggie here is, of these 75 to 100 million physician visits for the common cold, a third of them who saw their doctor for the common cold got an antibiotic prescription. Is the antibiotic going to do anything for the virus? Probably not. So again, $1 billion annually on 41 million antibiotic prescriptions. Quite a few. And again, when you have a common cold, which we know is caused by one of any number of viruses, it's really not bacterial. We may be creating more antibiotic resistance from the overuse of these antibiotics when they're not indicated. So that puts another strain on our healthcare system because now we've got to go back and deal with these antibiotic-resistant organisms. Missed days, 22 to 189 school days are missed. And so if the kids are missing school days, who else is probably going to be missing work days? The parents are staying home to take care of the kids, so the parents are missing 126 million work days to stay at home. Now, if they're not staying at home, then they're probably sick too. They have 150 million work days missed by employees suffering from a cold. The economic impact of that is around $20 billion. So if you add up all the money that's being spent yearly on just treating the common cold or battling the common cold or not working because you have a cold, it's in the billions of dollars. So $32 billion. You'd think the insurance companies may want to start thinking about paying for prevention. So prevention, what are some things that we can do that are just pretty easily? Again, avoiding contact with people who have a cold. That's not always easily done. Washing your hands regularly. Now, because these viruses are not bacterial, there's really no reason to use antibacterial soap to wash your hands. It's the scrubbing action that actually knocks the virus off of your hands. So even just using essential oils or just using non-antibacterial light soap is something you can do. It does not have to be antibacterial. The problem with constantly using antibacterial soaps is you're killing off the normal flora of your skin. May make you more susceptible to having problems down the road. Again, trying not to touch your mouth, your eyes, your nose, any opening of your body. Trying to keep your hands away from your orifices, basically. Get plenty of rest. Try to get adequate sleep. Again, gargle with salt water is a good way. If you know you've been around somebody who has a cold, just if we can prevent those little viruses from adhering to our tissue, then they may not get a foothold and we may be able to prevent the infection. So if you've been around somebody coughing or sneezing, doing the saltwater gargles can be a good thing. There's herbal throat sprays out there that keep especially if you're working in a heated environment that's dry, you can keep your throat moist throughout the day or suck on some sort of lozenge. But keeping the environment moist, because again, when it's dry and irritated, that makes you more susceptible to letting those viruses attack you. Saline nasal rinses, keeping those passageways clear. So keeping your throat clear, keeping the nasal passageways clear. Cleaning under, washing your hands is important just to get things off, but cleaning underneath the fingernails, even taking a Q-tip or a file and making sure you're washing under your fingernails, because that's where those little critters can hide out. And then again, watching out for simple sugars. We know that eating too many simple sugars in your diet can inhibit the ability of your white blood cells to attack foreign invaders. So that's phagocytosis, and we know when you eat simple sugars, you're going to limit your body's ability to attack those critters that don't belong. And then limiting your caffeinated beverages and alcohol, trying to limit those just because those are dehydrating. And again, moisture is a good thing for our mucosas, for the lining of our airways and our nasal passageways. If you're dehydrated, you're going to tend to dry things out. The more things they're dry, the more irritated they become, the more susceptible you are to infection. Okay, so again, antibiotics. We like them to kill off the critters they're intended for, like bacteria, but probably not good for viruses. So they really have no effect against the virus. And really for the common cold, we don't have any really good. There's some flu medications for the flu, but for just the common cold, there's not a lot of great things out there as far as conventional medicine is concerned. So mostly we're relying on symptomatic treatment, supportive options, and trying to stay comfortable. Well, what can we utilize in the natural realm? We're going to look at some different things that we can do as far as nutrients, botanicals, and then some physical medicine techniques. So the nutrients, those are going to be some things that are probably a little bit more familiar, and then we'll get into more of the unfamiliar. Well, vitamin A, where do we get vitamin A from? It's a fat-soluble vitamin, so it really only comes from our fatty foods. If you're not eating fatty foods, it's difficult to get vitamin A. You can make vitamin A from beta-carotene, which comes from your dark pigmented vegetables. But some people have a hard time doing that. So vitamin A, why is it important? Is it supports the lining of our tissues. It supports the epithelial tissue. And without vitamin A, we have a hard time really supporting the membranes, that line the respiratory tract, the intestines, urinary tract, the sinuses, the eye, all those things. So vitamin A is very important for the health of the lining of all these openings. It also, vitamin A is needed to get the little fingers in the bronchi or in the lungs, get those fingers working. Those little fingers in your air pipes help to push things out. So they push out the bacteria, the viruses, all the things that don't belong. And vitamin A helps to support that. Again, vitamin A helps provide a protective barrier for our body, so it can be a good preventative. It's also involved in our immune system, so it is an immune stimulant. You do have to use higher dosages of vitamin A to have it work in an immune-stimulating way. So when if you come down with a cold, you may want to consider doing 50,000 units of vitamin A for just a couple days, maybe 3 to 5 days in a row. You can do 50,000 once, or 50,000 twice. It's a pretty significant dose of vitamin A. You would not want to do this long term, but for short term, that can be a great way to kickstart your immune system. Now, if you're pregnant, I'd say you definitely want to avoid that. And whenever you take a high dose of one fat-soluble antioxidant like vitamin A, probably a good idea to have another fat-soluble vitamin on board, vitamin E, so you can take those together. Well, zinc, they have looked at zinc lozenges, and the zinc lozenges that contain zinc gluconate seem to be very good for supporting the common cold and help keep the airway clear. Now, if you go out and buy a zinc lozenge, it should have somewhere 10 to 25 milligrams of zinc per little lozenge. So that's what they've looked at in the studies. And again, you have to suck on those 3 or 4 times a day, up to 6 times a day, for that to have any benefit. Now, the problem is that the ones that taste good probably aren't all that beneficial, because they've shown that any of them that have sorbitol or mannitol, any of those little sugar alcohols, something about that sugar alcohol seems to make it not as effective. So you may be able to find them with xylitol, and then those would actually be more beneficial. But it should have zinc gluconate. That was really the one that was studied, and should not have any of these sugar alcohols in it. Well, vitamin C. Vitamin C is kind of a biggie, and that's probably one of the more common ones that people will reach for when they develop a cold. Again, vitamin C is very important for supporting our tissue healing. So it's a first-line barrier against infection. It does stimulate the immune system. It's an antibacterial. It fights off inflammation. It's a natural antihistamine. So it does a lot of good things for the body. It stimulates the immune system between 12 and 20 different ways. So it can be really great. With vitamin C, if you have a cold, you're probably best to just try to start boosting your vitamin C up right away and try to reach bowel tolerance. So you can take 1,000 or 2,000 milligrams every hour until it causes diarrhea, and then you back off, and that's your bowel tolerance. And so the next day you would try to reach that same target. But the more the merrier. So, as Dr. Cathcart said, some people have a 15-gram cold and some people have a 200-gram cold. We don't always know the target. You just have to try to go for your individual, whatever your bowel tolerance is. A great thing you can do is to put the nutrients or the vitamin C directly into your bloodstream. So that way, sometimes when you have a cold, you might have diarrhea, may have GI upset as well. So what you're taking in orally, it may be hard for that to get absorbed. So at the onset of a cold or in the midst of it, you can get an IV of vitamin C or an IV of something called Myers cocktail, which is just thrown together bag of all kinds of nutrients. And that can be very beneficial for a lot of different conditions. So that's something to consider as well. Monolaurin. Has anybody used monolaurin before? Well, monolaurin, it's just a lauric acid. It's a type of fatty acid that's found in breast milk, but it's also found in coconut. And so they took this lauric acid and esterified it and made something called monolaurin. And what they found is this monolaurin, it's actually active against influenza virus, pneumovirus, all these different viruses. So it's pretty effective against the common cold virus as well. And the way that it works is when you look at viruses, a lot of these viruses are enveloped. They have an outer lining similar to, we have an outer lining in our cells. But these viruses have envelopes, and those envelopes attach to our cells, and then those envelopes open and the virus material is injected into our cells. And then once inside of our cells, the viruses can replicate. Well, the monolaurin is a fatty acid that actually can get in the outside lining or layer of that virus and disrupt it. So it actually can help prevent the attachment of that virus to our cells. And that's what we want. We don't want those viruses to attach. It can inactivate the virus from binding to our cells and from getting inside of our cells. And then because it does that, it prevents the replication of the virus, basically. So it also attaches to the virus And anytime you can make something bigger, it's more easy for our immune system to see it. So when our immune cells attach to these little guys, and then they send off signals that say, over here, and then the immune system can come attack it. So this monolaurin sends signals basically to our immune system that, hey, the virus is here, come on over and attack it. So monolaurin can be a really good thing. You do have to take quite a few milligrams, 1,800 to 2,400 milligrams per day. But this is a biggie. When I found this, a lot of patients really do well with that. And I do have a lot of people, if they're prone to getting infections in the fall or in the winter, and they have COPD or asthma or things like that, I just tell them stay on that throughout the fall and winter. Well, the thymus gland, what's the thymus gland do? Who knows what the thymus gland does? So it's kind of, I think of it as being the boot camp for our white blood cells. It's where our white blood cells go to get trained. And it does play a real critical role in our immune system. Now, when we're born, it weighs less than half an ounce, and then by puberty, it's growing to around 10 ounces. The problem is that after we hit 20, this little guy can start to shrink. So it's just right behind our breastbone. Some people, because those things grow when we're babies, they used to radiate them thinking that they were abnormal growth. Well, they should grow when you're little because that's when you're training your immune system then, right? So it's okay if the thymus gets bigger when you're little. Now, the primary role of the thymus, again, it's to assist in developing a particular type of white blood cell called the T cell. It's to assist in maturing those T cells. We're going to look at the different types of immune cells real quickly. We've got T cells and B cells. So we've got white blood cells, and of our white blood cells, there's two branches. There's T cells and B cells. There's some other ones too, but we're going to talk about the T and B cells. Both of those cells are produced in the bone marrow. Now, when the B cells come out of the bone marrow, they're already mature like adults. They're able to go out and function in our body and do their jobs just fine. They don't have to go off and be trained. They come out of the bone marrow, they're ready to go and do their job. The T cells, not that way. They come out immature, and they need to go have some training so that they know what to do. So they have to migrate to our thymus gland, and that's where I say the thymus gland is the boot camp for these T cells. It's in the thymus gland where these T cells are programmed and trained to go out and do their specific duties. So when they come out of the bone marrow, they don't really know what they should be doing. It's the thymus that really programs them to know what to do. So these T cells, there's a couple different kinds. You've got the T helper cells, and these are the T cells that really orchestrate. They're like the conductor. They tell the immune system what to do, basically. So they're kind of in charge of the immune system. They go off and send signals to all the other different immune cells, kind of tell the immune cells where they need to go, what they need to target. And then you have the T8 cells. Well, their job is just to go off and kill things. And they're directed by the conductor, which is the T4 cell. So these are kind of the musicians with Uzis. So they're going off to kill things, and the T4 cells are telling them where to go. Then there's the T8 suppressor cells, and those are the cells that kind of ramp down an attack once they've deemed that it's okay to end the attack. So the T4 cells are telling the immune cells where they need to attack. The T8 cells are attacking, and the T8 suppressors are saying, okay, you've killed them, they're dead, you can stop. Well, the problem is, again, after age 20, our thymus gland begins to kind of shrink. It may be replaced with fatty tissue and connective tissue. And so as it shrinks, the thymic function may decrease, and then our ability to program those warriors can be lost. Well, that's where thymic protein comes into play. We can use thymic protein to actually stimulate the T cells. And so thymic protein, it's just a big long chain of little amino acids, which are the building blocks of protein. And this thymic protein fits on the receptor sites of T4 cells. And so once it's kind of plugged into those T4 cells, we think that it can help program those cells so that they can go off and fight viruses, infections, things of that sort. And the name of this basically is Thymic Protein A, so that's what they named it. And you can actually find thymic protein, and I have patients, again, just take thymic protein packets. It just comes in little freeze-dried packets, and you open the packet. You can put it in water, just put it directly on your tongue. Take a packet a day during the winter. If you come down with a cold, you may want to take a couple packets, 2 or 3 packets a day. Okay, we're going to look at some different herbs, and some of these will be more familiar and some not as familiar. These are herbs that actually have some sort of antiviral activity, meaning maybe they attack the viral envelope, or they prevent the virus from adhering to the cells, or they prevent the virus from replicating once it's inside of our cells. So some of these antiviral herbs work by just stimulating the immune system. So we're going to look at a bunch of different ones here. Well, there's Echinacea. We know that it works through stimulating our immune cells. It tends to work better if you can catch the cold early. Doesn't tend to do as much once the cold's already there. May not work as well in kids. We don't know. May work better in adults, but I have used it with kids too. So again, it can increase the production and activity of white blood cells, so it's stimulating our production of the immune fighters. It increases the production of a little chemical that can stimulate our immune system called interferon. It actually increases the ability of our cells to chomp on and chew on the bad guys, and then it can actually induce fever. So really the Echinacea can be a very good thing to use. You can find it pretty much in any form out there. It's Echinacea angustifolia is the one that you want to use, and the Echinacea, you can find it in capsules, you can find it in liquid, you can use a tea. Any of those things can be beneficial. You just got to start using that right away. Hypericum, so St. John's wort, its claim to fame is usually that its use, where it got a lot of media attention is for the use in depression. But Hypericum, actually, the St. John's wort, it has these constituents in it that actually can break down encapsulated viruses. So this is kind of a biggie in my mind as far as whenever you have a cold, using this to try to attack the virus. Now, oftentimes with colds, you have body aches, pains, things of that sort. St. John's wort can be good for alleviating those body aches and pains as well. There's a New Jersey tea, Ceanothus. It can be a good gargle. You can buy this in liquid form and gargle with it, and it's an antiseptic. So that's something you may want to mix in with the salt water, or just mix in with hot water and use that as a gargle or a throat wash. Garlic, again, it's a good antimicrobial. So you can cook with garlic. You can take capsules of garlic. You can do all those different things, but it's a great antimicrobial. Now, the one that you don't hear as much of is Baptisia or wild indigo. This was probably my favorite one when I was in Seattle working in some of the community health clinics. People would come in with strep throat and would refuse to get on antibiotics. And so you could use this Baptisia or wild indigo, and it worked like a champ. So it's probably one of the stronger antibacterial, antiviral herbs that I know of. Now, the reason, it's got these little polysaccharides that are just like these big, long sugar-type molecules, and it has something called arabinogalactans in it. And these have gotten a lot of claim to fame over the last 10 years. I know there's some multi-level marketing companies that are selling these things for like a jar for $200 or something, when if you know where to go, you can get it for about $20. So these arabinogalactans stimulate the immune system. They're just these polysaccharides that have a great way of stimulating the immune system. They did do a study that I found where they used the Echinacea, white cedar, which is thuja, and wild indigo together, and it did significantly reduce the symptoms of the common cold. So the wild indigo tends to be something, if you can find a liquid botanical that has the wild indigo in it, or you can buy the capsules, that's something that you would use if you had the cold. This is not really a great preventative. You don't want to be on this long term. It's something that if you have a cold, you can go out and buy it, and it can knock that cold out for you. Eleutherococcus, this is something that you can use long-term. This is Siberian ginseng. And it does, it is an antiviral. It is great for stimulating the immune system. We know that it actually helps to enhance the T lymphocytes. They did a study, it's been about 20 years ago when they did this study in Germany where they looked at people who were taking Eleutherococcus on a daily basis, and it reduced their work-related absence by 1/3 compared to the control group. So Eleutherococcus is a great one. It's great for adrenal support. It improves your energy, stimulates your immune system, stimulates white blood cell production. It's directly antiviral. It's one of those you can take long-term. It's generally sold in solid extract, so it comes in like a honey base, and you take a 1/2 teaspoon to 1 teaspoon a day. And that's one that I say, yes, probably it's a good idea to take that throughout the winter. Ligusticum, or Osha, that's known as singer's herb because it's a real popular throat remedy. They'll put that in a lot of the different throat formulas out there. Ligusticum, again, it will raise body temperature. When you take Ligusticum, you may actually notice that you're sweating. It is a diaphoretic, so it does help to stimulate fever. And as stimulating fever means it's turning on the little chemicals that stimulate your immune system. Again, that one, generally found in throat sprays or gargles, and you can find that in liquid form most of the time. Lomatium is probably the best antiviral herb that we know of. It's also one that a certain percentage of the population will not be able to tolerate if you get the wrong stuff. But this does have antiviral activities against both types of viruses, DNA and RNA viruses. It has a constituent that basically breaks down the viral coat and prevents it from adhering to your tissues. Now the problem with taking lomatium is some of these herbs that are out there, they don't extract this resin fraction, and probably up to, I'm not sure what the percentage of the population is, but a certain percentage of population, this can cause a whole body rash, and it can be very irritating. So we don't know for sure if the resins are necessary for the antiviral response, because when they study this herb, they generally study the whole plant extract. They have used it taking these resins out and have had benefits, so we think it's probably okay if you just take the resins out. Now the rash is not long-term. It will resolve after a couple of days, but it can be very intense and very painful. So if you think you're one of those who may react adversely to plant medicines, it would be a good idea if you're going to get lomatium to find the one where they've taken out the resin. But again, this one is probably the most, well, probably as far as natural medicine goes, with naturopathic physicians, it's one of the more widely used antiviral medicines. To me, it's probably the best. If you can find something that combines lomatium and wild indigo Baptisia when you have a nasty cold, then this will generally take care of it. So Baptisia and lomatium are two that you do not take long-term. These are short-term herbs. You don't take them unless you actually have a reason to be taking those. They're not preventative. They are there to attack something that doesn't belong. Licorice, again, it's a great herb just to take long-term. Licorice and Eleutherococcus go hand in hand. With licorice, if you have high blood pressure or are prone to low potassium levels, you may want to take a lower dose or make sure you're taking potassium if you do take the licorice. But again, it's an antiviral. It works very similar to the way that St. John's wort works. And with that, they generally sell it as a solid licorice extract. Comes in a honey-type base. Take a 1/4 teaspoon to a 1/2 teaspoon once or twice a day. Now, this is something that I've used. This is there's a Dr. Heron who's a naturopath, and she came up with this formula basically, and it has most of those herbs that I just talked about. And so this one, it's strong and it's nasty tasting. It's probably one of the nastiest things you could put in your mouth. But if you mix it in a little juice, mix it in hot water, gargle it, and just swallow it down. And it's not, this is if you have a viral infection, then get on that. And then I say you probably take a teaspoon 3 to 6 times per day. really no more than 2 weeks. You don't want to be on those strong, powerful herbs more than about 2 weeks. Now, the other ones, the lomatium and the wild indigo, you definitely don't want to be on for more than about 2 weeks. Most of the other herbs you'll be fine to be on. Okay, we're going to look at some herbs that also have a powerful effect on supporting our immune system. They may not be directly antiviral. They don't necessarily attack the virus directly, but they do stimulate the immune system. So astragalus, that's a pretty popular one out there. Again, it's a great immune stimulant, and it actually stimulates the activity of our natural killer cells so that they can go off and fight. Again, it helps our cells work as Pac-Man again so that they can eat the bad guys, and then it helps them to make more of the bullets, these superoxides that are little chemicals that our immune cells can spit out to attack the bad guys, basically. So astragalus, again, has been shown to be helpful with chemotherapy patients who've developed immune suppression. So when their white blood cell count goes down, astragalus is something you can use because it actually increases different factors of the immune system. So it can help to increase our B cell count and increase the antibodies or the immune factors that these immune cells make. Well, poor man's ginseng, this can be a good one too. It's often used in traditional Chinese medicine formulas. But this one really has been shown to increase the red and white blood cell count. So this one can be useful with chemotherapy, can be useful in the winter months to try to stimulate your white blood cell production. Good for appetite suppression. It'll help if you have an appetite loss. This can help stimulate the appetite. So, and then we know that it replenishes the chi. That's kind of what they say, that it's replenishing the energy of your body. Ligusticum, and again, the poor man's ginseng and the astragalus you can use throughout the winter months, the fall and the winter. So you don't have to use those short term. You can use those long term. Ligusticum, again, it's been shown to have antiviral activity against quite a few different viruses. It increases the killer cells again. It can stimulate white blood cell count. So all these are basically stimulating to the immune system. The wuwuzi, or the five-flavor berry, Schisandra, it's what we call an adaptogenic herb, so that if your immune system needs stimulated, it can bring it up. If it needs dampened, it brings it down. So it's trying to regulate the body. Now, it has a lot of lignans that are great for regulating hormonal factors, and we think that because of that, it can be beneficial to the immune system. But it's an immunomodulator. So this one can be actually a good one to use in autoimmune type diseases. Now, medicinal mushrooms, there's lots of different mushrooms out there. A lot of the times it's best just consider taking these in combination. There's a lot of different Japanese mushrooms that have been shown to be pretty beneficial. Maitake, shiitake, reishi, all those different mushrooms can be very beneficial. And the reason is because they're high in those polysaccharides, those long branches of sugar-type molecules that stimulate our immune system. So these polysaccharides are what are responsible for stimulating the immune system. With these mushrooms, you can generally buy them in capsules or get the powdered mushroom formula, or just go buy the whole mushroom extract at the Asian grocery stores. But generally 5 to 10 grams per day in divided doses is what's going to be beneficial as far as using those mushrooms. Using vitamin C will help to increase the absorption of the mushrooms. And so if you're going to take those, taking vitamin C with that may be beneficial. Okay, there is something called PhytoGuard 2, and this will help to build up your white blood cell counts. So I have seen this in women whose white blood cell counts are low. We can give them this, and their white blood cell counts do come up. So I really like this one. It has all those different herbs that can stimulate your immune system. Again, with that, you could take that throughout the winter, take it throughout the fall, and it's not the best tasting either, but a half teaspoon 3 times daily in water. Anyone who's been on chemotherapy, who's had immune suppression, that's a good one to push them up. if you've been on any medication that has suppressed your white blood cell count, this can sometimes be good to use. And then if you've just had a long-term history and for no reason at all your white blood cell count tends to be on the low end, this can be a good formula to stimulate the bone marrow to produce more white blood cells. Well, as far as keeping the throat moist, again, you can do the zinc lozenges. Just chewing on the different herbal throat lozenges as well can be good. There's something that I use that I just keep in my office drawer starting about now because I'm around all the sickies. That's this Botanical Throat Support, and what it is, it's just a mist. It's a spray of botanical medicine that you can spray directly to the back of your throat and just kind of keep that lubricated. But it's a good way to get a good source of antibacterial and antiviral herbs directly on your tissues. And I generally, just for prevention, will use that throughout the day, 3 or 4 times a day. Now, if I do get a sore throat, then 3 to 4 sprays to the back, and you can use that really as much as you want, but about 10 times per day. The one that I use, it has Echinacea, hyssop, monarda, osha, prickly ash, propolis, and bitter orange. Again, the Echinacea is an immune, it's an immune stimulant and it's an antiviral. If you do have a little bit of a cough, this hyssop works as an expectorant to get things up, so that can be a great way to get the congestion out. The monarda is just relieving. It's a demulcent that will soothe and coat. So if you have a scratchy, irritated throat, that can be good there. Again, the osha is the singer's herb. Prickly ash actually stimulates your salivary glands to produce more saliva, so it helps to keep your mouth moist. Propolis, again, it works as a demulcent. It coats and soothes and stimulates the local immune environment. And then bitter orange oil is a directly antimicrobial agent. It also anesthetizes things so that if you have a sore throat, it can actually calm that down. Lymphagogues. Lymphagogues are just something that helps to break down hard tissue in the lymph system. And one of the best ones is Phytolacca. It's pokeweed. Now, a lot of the times people get into problems because things get hard and congested, and they can't get them to break up, and then basically drainage is not allowed. If you get a hard lymph node in your neck and all of your head needs to drain down through your neck and into your chest, pretty soon you prevent that drainage and then you create a soup upstairs, and that can lead to sinus problems. So keeping the lymph system flowing can be a really good thing for colds. This Phytolacca really works good for trying to soften up the lymph system, basically. Now, the problem with this Phytolacca is you have to use it in very small dosages. So if you go out and buy Phytolacca in liquid form, you're only talking about taking 4 to 5 drops mixed in water. It's very powerful, but it does have some alkaloids that if you get too high of dosage can be fatal. So you don't want to use teaspoon dosages with this. It's just drop dosages. Okay, we're going to talk quickly here about some different types of hydrotherapy that can be beneficial during cold season. And so the first one is a mustard pack. Has anybody used mustard pack before? Nobody? These can be fun. So basically, you just apply these to the chest. They work good for colds and coughs. You can apply them to the front of the chest and to the back. Now, this mustard, or you can also use mustard oil, it gets absorbed through the skin, usually into the lungs, and then it helps with expectoration, breaking up mucus, all that good stuff. Now, and mustard in and of itself is antibacterial. Now, the way you do this, and I didn't put those directions in here, so you go out and you buy dry mustard, and you can take 1 or 2 tablespoons of dry mustard, and you mix that dry mustard in a bowl with just a little bit of water at a time, hot water, until you form a paste. Once you form that paste, then you can get an old T-shirt or a terry cloth, and basically you take the T-shirt and put that paste over the T-shirt, then take the other half of the T-shirt and put that over the top of that. Take that T-shirt and put it directly over your chest or over the back. And then you wrap that with saran wrap over your chest, and then put a hot water bottle or a hot pack over the top of that. You leave that on for no more than about 15 minutes. You will feel it kind of start to tingle in the chest. It can be a little bit irritating. If you feel like it's getting too hot, just pull it off. So really no longer than 15 minutes is needed, but it generally will make you cough, and it will make your lungs feel a little bit irritated. But it can be a great remedy, especially for things that just aren't going away. I mean, it can be a really great thing to use. But do it for 15 minutes on the front and 15 minutes on the back. If you have kids, you can use this. You probably don't want to leave it on more than about 7 to 10 minutes for kids. The wet socks, my old favorite. If you've been here before, you've heard the story. But basically, the wet sock, what we're doing is putting cold, wet socks on the feet, trying to get things to drain down from our upper respiratory down to the feet. So we're trying to redirect the flow of traffic in our body so that we can relieve the congestion upstairs, push the congestion downstairs. And so again, with this, you're just basically taking a pair of socks, putting them in cold water, wringing those out. You can even put them in the freezer. After you get them cold and wet, you can put them in the freezer just so they're extra cold. Then you need to warm your feet up before you put these socks on. So you can put your feet in the bath water or just a basin of water. Try to get your feet warm before you do this. Dry your feet off, then take those cold, wet socks that should be wrung out. You can put those cold socks on your feet. Then take a pair of thicker wool socks that are dry, put those wool socks over those wet socks, and then you climb in bed. And then you can cover up. And basically you just leave those wet socks on throughout the night as you sleep. Most people, this therapy is a little bit sedating, so it tends to help you sleep because it's kind of draining the blood flow from your head, which can be relieving if you have congestion, but it's also sedating. By the time you get up, those socks should be completely dry and should feel hot, but there should not be any moisture left on them if your body was doing what it's supposed to do. So really, it's draining all that congestion from upstairs, downstairs, and this can be a great therapy. Every year we do this on our kids, and I've got 4 girls, and so I'm always doing the wet sock, and they actually start to like it after a while. So, and I do it on myself, and it's not. I mean, it's really not a big deal. It sounds worse than it is. Heating compress. This can be a great one for sore throats to try to stimulate the local immune system if you do have a sore throat, pharyngitis, tonsillitis, something along those lines. Again, this one sounds worse than it is. I promise it actually feels good if you do it. And this, again, is you take a hand towel and you wet that hand towel in cold water, and then you can stick that in the freezer if you want to. It just depends on your tolerance. And then you just want to loosely wrap that around your neck. So all the way around your neck, but make sure it's loose so that you can breathe. Then you take a dry bath towel, a bigger towel, should be about 2 or 3 times the size of the smaller hand towel, and it's completely dry, and then you wrap that around your neck loosely. And again, you can lay down or sit down, watch TV, read a book, or whatever. You want to leave that on for really as long as you can tolerate, but for at least about 20 minutes. What that does is it really stimulates the blood flow and pulls those immune cells to that area so that they can go and do battle. And this has just been a really great remedy for sore throats. So this also works good for stiff necks, if you have neck pain, headaches, things of that sort. But really works well for sore throats. So if you do, what I'll do is I'll do go ahead and do the mustard pack. If you have a real nasty cold, do the mustard pack. Then put the heating compress on, go to bed, and put the wet sock on top of that. So it does wonders. So I think that's definitely something to consider. Okay, I think I'm done. Again, prevention, so hand washing, washing your eyelids, using nasal washes in your nose, gargles in your mouth, trying to prevent adherence of those little critters. If we can prevent them from adhering to our tissues, then maybe they'll never get a foothold to begin with. So if you're around sick people, make sure you're trying to prevent the adherence of those viruses. Taking just nutrients and botanicals on a regular basis as a preventative, so some of those botanicals that are safe to take long term, those are good to take throughout the fall and the winter. And then, you know, if things come about, you know, it's too late, you've got the cold, then take some of those heavier hitters like the lomatium and the wild indigo. Those can definitely be good to have on board, and the higher dose vitamin A, and then incorporating the hydrotherapy. Okay, we'll take questions. And they'll come around with the mic.
Good information. Yeah, we'll take a few questions. I'd like to remind you that we do have tours every day of the center facility at 1:30, so following the lunch and lecture and the restaurant hours, we will have a tour at 1:30.
What part of Echinacea plant is used? I have, you know, Echinacea grows all over my backyard. So
Yeah, the root.
Yeah, the root and, oh, the root is
Yep.
the one. Okay. So can you make tea with it?
Yeah. Yeah, since it's a root, you just have to, you have to dry it, and then you boil it. You actually put the root in the water and boil it for 15 or 20 minutes. So you have to decoct it instead of infuse it, basically.
The Q-tip thing, do you wet it first in boiled water or just a dry Q-tip?
Well, you can use like sterile water, and if you're, and then you can dip it in that and then just wash it. So yeah, I'd get it wet.
Okay, so these microorganisms go through like lag-log stationary, right?
Say that again.
These microorganisms that we've been talking about go through lag-log stationary decline, right?
I have no idea what you're talking about.
Like from beginning to end, like their stationary phases.
Oh, okay. Yeah. Uh-huh.
Okay.
Yep.
So like the remedies that you have provided, when do they come into play? Like when they're growing or when they're multiplying?
Well, and that's the thing. Is some of these, because you want to prevent the adherence, so some of those herbs are working to prevent the adherence of the virus from adhering. Some of those are preventing the virus from multiplying once it's already inside of our cells. Some of those are just stimulating the immune system. And so really, I just say you just want to start using basically all of those right away. So there's no rhyme or reason. Some of those you can use long-term just as an immune stimulant so that your immune system is on constant guard to try to prevent those from ever getting a foothold. But then once they do get a foothold, I mean, I think you're fine to just go ahead and use all of them all at once because, again, some people, it depends on the virus, the replication cycles are going to be different. The time before they actually enter the cells is going to be different. So as soon as if you know you're around a sick person and you're prone to having those infections, if you want to start on some of these more powerful things right away, that's not a big deal.
Are you, when a person has a cold, are they contagious the entire time from contact through healing or? No,
not necessarily. I mean, those initial few days when you first come in contact with the cold, and then as the virus is replicating, once your immune system begins to attack that, then you're not as contagious.
So the first 2 or 3 days?
Well, it varies, but yes, probably for about the first 5 days. Mm-hmm.
Okay.
I was saying, how many of these herbs can be purchased here, Chad?
Pretty much all of them. Okay. Yep. So those 2 formulas that I talked about, they have upstairs.
My question is, can you get all these things upstairs, and can kids take all of them?
You can get them upstairs, as far as I know, unless they're out of them. But, yeah, those herbal combinations that I mentioned, you can get upstairs. Monolaurin, I don't believe they have upstairs, so you'd have to find that somewhere else. But you can check with them. Kids are safe. You just have to kind of Clark's rule. So you basically take... I would say you just have to proportionately, for an adult, the average age is 20, minus the kid's age, and then 1/3 of that. So, but yeah, the kids can take those.
I was wondering, do you take flu shots? And if not, why not?
I don't take flu shots. Now, I'm not immunosuppressed. I don't smoke. I drink alcohol, but not all that much. I don't really have any of the risk factors. I'm not over 65, so I don't have a lot of the risk factors that would make me want to take a flu shot. I don't have COPD or asthma or any chronic obstructive pulmonary disease either. So there's really no reason for me to take a flu shot. I also will take these herbs throughout the fall and the winter to try to stimulate my immune system. I'd rather try to stimulate something naturally than take something that's dead that could possibly harm me. Yeah. Yeah. I think you have to take a lot of factors into consideration, so it's kind of an individual decision based on your health.
The preceding program was presented by the Center for the Improvement of Human Functioning International in the Bright Spot for Health Lunch and Lecture Series. To inquire about additional health-related information available on DVD, audio CD, VHS, or audio cassette, simply call 316-682-3100 or drop by 3100 North Hillside in Wichita, Kansas. To discover more about the center and what we have to offer, be sure and visit us on the web at www.brightspot.org.